Please start the conversation.
Good afternoon. I'm Dr. Kajol, one of the doctor working in this clinic. May I confirm your name, please?
Yes, sure, doctor. My name is Smith.
Okay, Smith. What brought you? Could you please tell me what brought you here today?
Yes, doctor. Actually, I'm very much concerned about my baby. He's here, and he had 8 to 10 episodes of diarrhea, and also he vomited twice. And after that, I brought him here into the hospital, and they admitted here. Now they want me to go back, but I don't think it is a better idea. I would like to stay here. So that is the reason I'm here.
Okay, Mr. Smith. Before proceeding, I would like to ask you further questions regarding your child symptoms, if you don't mind.
Yes, sure, doctor.
Could you please confirm your child age, please?
He is 10 months old.
Okay. Have you noticed, does he pass urine frequently or any change?
Yes, doctor, he is urinating regularly. Along with that, he also has a fever and cough. And his nappy area, I think it's little sore.
Okay. Sorry to hear about that. I know being a parent, I can understand being a parent, that must be a stressful situation for you. But based on the symptoms, I believe that your child is having a condition called gastroenteritis. Have you ever heard about that, Mr. Smith?
No, doctor, I've never heard about it.
Okay, let me explain this for you, Mr. Smith. So this is actually an infection, a bowel infection, uh, that that may be because of many causes, but it results with diarrhea, vomiting, but more frequently it will resolve with time. So I will let me reassure you that there is nothing to worry about. Your child is doing good now, and we will provide you proper guidelines so that he will be fine soon. I think I'm clear to you, Mr. Smith.
Yes, doctor, but why don't you just put my child for a few more days here? I mean, you can see that he's very weak, and I'm quite panicking at the moment. So, is that okay if you could just give him medication here in the hospital?
Mr. Smith, I can understand your concern, but let me tell you that your child is doing good now. So I I believe that it is inappropriate to prescribe any medication at the moment. But the good thing is that we have some other options, like we can prescribe you like gastrolite or a glucose solution that you can give your child and he will improve. Am I clear, Mr. Smith?
Yes, doctor. It's okay. Then what should I feed my child? I mean, as you can see, that is vomiting and having diarrhea. What should I do?
That's a good concern. But you can continue breastfeeding even more frequently than before. But regarding your food concern, I think initially child used to refuse the food. So with the ongoing time, you can have the good food intake or suitable food intake. But for now, you can continue breastfeeding. Am I understandable to you, Mr. Smith?
Yes, doctor.
So do you have any more questions?
No, doctor.
Okay, so here is my card, and you can come back anytime you feel your child is not feeling good. Thank you, Mr. Sharma.
Okay, Dr. Kajal, I hope you have seen the improvement. Very well presented card. Definitely you will pass with this way. And a very important thing that I would like to mention, see, in between when you're saying that, let me explain, let me ask you a few more symptoms, then don't ask the age. Okay? In between, there is no need to ask age. If you want to ask the age and the thing, ask it in introduction. When you're saying that, let me explain, let me ask you more questions about the symptom of your child, then there's no need to ask and age and thing. And even if you won't ask the age, doesn't matter. Okay. at the end. Like in between, it's not good. At start, it's better to ask. Okay. The rest of the things were fine. Eventually, whatever the shortcomings are, I'm going to practice the card at the end. You will understand. But overall, this was much, much better presentation. And I hope you have seen that as well.
Same.
Definitely, we have some time, whatever the time is remaining. We'll more practice. We're going to improve a lot. And but till now, this was the best. Okay, and definitely a pass. Okay, but we'll improve, inshallah. Okay.
Thank you, sir. Yes, sir. Sure, sir.
Oh, okay. Yeah. So who wants to go next?